everyone else's. Welcome, everyone. My name is Gina Clonan. I'm the founding president of the Connecticut Women's Hall of Fame. For nearly 3 decades, the Hall has worked to discover and share the stories of women. Our various educational platforms acknowledge the individual and the collective feminine voice. There is no more important time than now to talk and listen. This will be a half-hour intimate and informative chat, followed by 15 minutes of your questions, which we encourage you to submit at any time during this webinar by simply clicking the Q&A bubble at the bottom of your screen. I'll try to get to as many as possible. Our goal is simple, a virtual gathering to talk about today's important issues. We hope this to be a useful source of information while offering up helpful takeaways. We are thrilled today to have with us a woman well known across the state, a former state rep, secretary of state, gubernatorial, Senate, and attorney general candidate, and presently the lieutenant governor of the state of Connecticut. Please welcome the Honorable Susan Bysiewicz.
Gina, thank you so much for having me. It's a pleasure to see you virtually, and it's nice to be with my colleagues who are supporters of the mission of the Women's Hall of Fame.
Well, thank you again. And for the essence of time, I'm going to get right to it. If you wouldn't mind, Lieutenant Governor, let's begin with a quick review to date of Connecticut's response to the coronavirus pandemic, and perhaps speak to how has mitigation and containment fared here? How is our state doing? Are we different from others? Are we the same? Are we better?
Well, first of all, we were one of the first states to declare a public health emergency, and Governor Lamont and I had been watching the coronavirus and looking at it since January, and it was a concern, but on March 10th, the governor did declare a public health emergency, and then on March 23rd, his order to put into effect the Stay Safe and Stay at Home initiative went into effect. And I would say that Connecticut has done very well compared to other states. We were a hotspot because of our proximity to New York. And indeed, our first case came out of someone who lived in New York but worked at Danbury Hospital. This is a disease that knows no borders. And in fact, many of our first cases were in Fairfield County with people who had gone back and forth to New York City. And we have, since declaring this a public health emergency, the governor and I have met daily, virtually, with our commissioners, and we are on a daily command call with our commissioners and our emergency management professionals, and also included our public utilities and the Red Cross and other organizations like FEMA that are critical to our response. And we have also had a very collaborative way of working with our municipal leaders, and we speak regularly with them. At the beginning of the crisis, we were speaking with them 3 times a week. We're down to 1 time a week. And we just started meeting, doing our regular command calls Monday, Wednesday, and Friday. And we're doing that because now we are seeing the fruits of the Stay Safe and Stay at Home initiative. We've seen a reduction from 2,000 people hospitalized to just over 1,100. And we've also seen a nice drop over the past 2.5 weeks of people coming out of the hospital. So there's been a decline in hospitalizations. We had a little bit of a spike yesterday in the number of fatalities, but we had been seeing a slow reduction in those.
Let's
And
stop for just one moment before we continue with some of the stats, because you mentioned something that I think is certainly of interest to me, and I'm sure for all our listeners. We know it takes a village, and now more than ever, teamwork is essential. Can you give us a behind the scenes look at the state government in crisis? When you say you get your teams together and you're talking to people, who are they? How have they come to be part of this? We're just wondering, we see your face and the governor's face, but who else is there working on this with you?
our trusted partners are our leadership team. So that would be Paul Mounds, who is the governor's chief of staff, Josh Jabal, who's the chief operating officer, and all of our cabinet secretaries or commissioners. And there are 27 commissioners. And for those on the line, I want them to know that about half are women and 40%, give or take, are people of color. So we're very proud of this diverse administration because we rely upon our partners. And so those commissioners or cabinet secretaries are the people that are helping lead our efforts. We have special teams on public health, and we have a special team for food security. I've been working on the food security front along with our Commissioner of Agriculture and DJ Giffords, who is our Commissioner of Social Services, and she is also now the acting head of the Department of Public Health. And Deidre is a medical doctor herself. She is also an epidemiologist. And she specializes in work with nursing homes. So we're thrilled that she's helping us lead this effort. The governor also has a Reopen Connecticut committee, which is comprised of David Layman, who is our Commissioner of Economic Development, Dr. Coe, Indra Nui, and many other people who are either in the health field or in the business field. The idea is to move us purposefully but slowly toward reopening our economy. And the governor has tasked me with creating local economic recovery groups at each town and city so that the diversity of interests of the different ethnic communities in each town or city are represented, and that the differing needs of those communities are met.
You touched upon something of great interest, and we're seeing it every day on the news, the food chain, the food supply, and those in need. Before we went online, you talked a little bit about your experience today. Would you like to tell our listeners what you saw?
So I'm sitting in an empty conference room at the Norwalk City Hall, and the mayor invited me to join him at a food bank drop-off at Veterans Park in Norwalk, where the Connecticut Food Bank was providing a week's worth of food to families. And it was a sight to behold to see 2,000 cars waiting patiently to pick up a supply of food, including produce, potatoes, dairy products, protein like chicken, etc. It reminds me of what my grandparents talked about, recalling the breadlines of the 1930s. The pandemic has caused an economic catastrophe for our state, and families are stressed. We have about 20% of our workers are unemployed. And I was saying to you before we started, unfortunately, this pandemic has hit women the hardest. And why do I say that? Well, we've started to look at the people who are unemployed, and nearly 60% of the unemployed people are women workers, and they are in the fields of retail, social service, the hospitality industry, hotel, restaurant workers. These are people who were now left jobless. And these are also many of our lowest wage workers. And at the same time, we know that women are on the front lines as warriors in this battle against COVID-19, because they are our nurses, they are our grocery store and pharmacy clerks, and our delivery drivers and postal workers, and all of those essential workers that I think all of us now, we appreciate, but now we appreciate them even more.
And we used to call that pink collar jobs. And there is still a prevalence of women in those essential service working frontline jobs. You mentioned hospitals. We know that a lot of nursing home care is done by women. And we also know we share the burden of not only taking care of our own children, but often our parents and other family members. There's, in Connecticut as well as across the country, a lot of multi-generational living. And that also puts the entire group at risk, either for the disease or the economic fallout.
And these are the conversations, Gina, that we've been having with small business owners, because many of our small businesses are owned by women. So they have their kids at home through June, we know, and they are trying to balance making sure that their kids are doing their online or virtual learning, trying to do what they can to keep their business going. And there's just a lot of stress. So many are unemployed. 60% of the unemployed people in our state are women. So this is all a lot. And that's why one of the things that the governor and I really wanted to focus on is making sure that the social safety net programs are available, so that unemployment payments are being made. And I can tell you that our labor commissioner reported to us yesterday evening that 93% of the claims have been processed, and a good portion of the federal pandemic unemployment for gig workers or small business owners or self-employed people are starting to get processed. And we wanted to make sure that food security was front and center, because in good times, 1 in 9 people, adults, are hungry, and 1 in 5 children are hungry.
In good times.
Yes, in good times. And so that's what explains this huge outpouring of need for food. But here's the good news. The good news is that the people of Connecticut are extraordinarily generous. And so the food banks have Food Share and Connecticut Food Bank that provide food to food pantries across the state, and there are more than 100 of them, have seen greater demand, but they've seen many more donations from individuals who have given what they can, either a little or in some cases a lot. And so we're so grateful. And that's why when the governor and I feel that, gee, this pandemic is creating overwhelming problems, yet we see the generosity of volunteers coming forward. There were dozens of them. We see what people are giving, and we know that this is how we're going to get through it.
Well, that is certainly good news. And I did want to just back up a little bit on aid and the aid packages that are available, because we had heard a lot about issues in applications, processing, fund distributions. From what I heard you just say, we seem to be back on track. And can you talk a little bit about, there is news of perhaps some more aid packages coming. What is still available for people? Maybe we have some listeners who haven't applied yet because they've heard.
Well, the good news is there is federal aid still available from the Small Business Administration, and our commissioner of the Department of Economic Development said, remarkably, there are still funds. So if you have a small business and would like to apply, please go to your local community bank, and also all of the big banks also what can help you make that application to the Small Business Administration. It's interesting because in the first tranche of federal funding, there were lots of applications, and that money ran out extremely quickly. And we are amazed that there's actually still funding left. And now in the second tranche, that second tranche of funding is particularly for smaller businesses. And the Congress made sure that the community banks could participate, because a lot of the big banks, Bank of America and some of the biggest financial institutions, gave out the first tranche. And so what we're finding is now the average loan size is in the 60,000 range, as opposed to the first tranche where the average was more in the 220,000 size.
There still is a great opportunity for our listeners and people around the state to apply for the aid that they need.
Yes, the SBA
program. Food
program.
stamps available for people when we talk about food insecurity?
So yes, so SNAP benefits have been expanded. So if someone was on SNAP, they may be eligible for more benefits, and there is extra SNAP aid. So I always say to people, if you need food, please apply. And the best way to apply for SNAP is to either call the Connecticut Department of Social Services or call your social services professional at your town or city hall, and they will help you to get signed up for that program so that you will have food, because the federal government and Congress has recognized people need this given the massive amount of unemployment that people are working through.
That's very valuable information. And as today is May 14th, and it appears that we're approaching a soft opening, government guidelines seem to indicate, and global data, that before we can get back to any semblance of normality, we need virus testing, contact tracing, and antibody serology tests. They appear to be in short supply. What can we expect here in Connecticut?
So the good thing is that yesterday we exceeded the governor's goal of 42,000 tests a week. So we are saying that for now we are able to be doing probably in the vicinity of 50,000 tests a week, but the goal is to ramp up substantially. And by August, Yale Hospital just announced that they are going to be able to, by sometime in August, be doing 100,000 tests a day, which is remarkable. And there are other providers like pharmacies that will be doing those as well. CVS is going to be doing them as well. So our testing is going to be significantly ramped up. And the reason that that is important, to your point, Gina, about beginning to, in baby steps, slowly open our economy, is that employers will want to know that they have all their employees tested so that they and their employees are safe. And we want to make sure that testing is available particularly as we go into the fall, because all of the medical experts are predicting a spike or a second surge in the fall, because this is how flus and this particular disease seems to go.
So tell me, who gets a test?
So now anybody gets a test. Anybody who wants one can get a test. You no longer need a doctor's note or order to get a test. And you can go to our state website, to the COVID-19 section, to find out where the closest place is for you to get one. And you do not need a doctor's test. And now doctors, pharmacists, and other medical personnel are specifically authorized to be able to give those tests by our Department of Public Health. And we want people to get tested. And we also want people to sign up for contact tracing, because that's going to help us keep each other safe as well.
And speaking of contact tracing, have we hired, or I don't know how it's done, but my understanding is you need tracers. So have we created a large network of tracers across the state?
Yes, so we have done that, and we are working on putting all of that together. We put out an RFP. There is a vendor that has been selected, and we will be working with local health departments and volunteers who volunteer to help with that tracing, and that's going to be key as we keep each other safe.
And for the lay people, contact tracing is people making phone calls. Once someone has tested positive, you talk to that person, find out who and where they've been with, and then the contact tracer would then start making phone calls, or how is that carried out?
Yes, so that is carried out in exactly the way that you just described. The public health department at the state of Connecticut, and also in each local health department, they have been actively engaged in having those conversations with people who have tested positive. There is also another way to do it, and some states like New York and Connecticut have contracted with firms so that you can sign up for contact tracing on your phone. And this isn't going to give any unauthorized people any information, but it will allow you to know who you've personally been in contact with, so that should you get sick or someone you have been in contact gets sick, they will have the ability to let you know, or you can let them know that you're ill. And this will help us hopefully avoid getting many, many people sick and avoid future outbreaks.
And as we're talking about tests, I presume we're talking about a test for COVID-19, but are we also talking about the serology tests that examine whether a person has the antibodies?
Yes, although there some of those tests are more effective than others. So yes, the antibody tests and ramping up antibody testing that is reliable is the next thing, but we are all learning this together. And another reason for mass testing is we find that there are a lot of asymptomatic people out there that are COVID positive, yet they have no symptoms. They're walking around with no issues, and they may be working at a grocery store, or they may be working in a healthcare facility. And that's why it's so critical that we test our frontline essential workers, but also that as we begin to open our offices, as we will on a part-time basis, if you will, we're saying, offices can begin to reopen, but if people can still work at home, let them do that. Maybe have staggered hours so you have fewer people working in offices at once, and put social distancing measures into place. So this is going to be sort of a gradual process. We've got offices remaining retail, restaurants opening on an outdoor basis, outdoor museums and recreation spots opening. And we're slowly moving to get back to what we're all used to.
And when is the proposed date for this sort of soft opening?
So it's May 20th. And if people want to take a look, because there have been different guidelines posted for offices, for restaurants. So if you want to take a look at what those guidelines are, you can go to the Department of Economic and Community Development. They've been spending a lot of time, and they put a lot of thought with the Reopen Connecticut Committee into how we can keep social distancing, but at the same time understanding that, for example, that the restaurant industry accounts for about 10% or more of our economy. And we want to keep those restaurants going, especially those Main Street businesses that we all love in our towns. And so the governor decided to start with outdoor dining with the idea that hopefully by the end of June, we'll be able to move toward dining indoors.
Before we continue, I just want to remind our listeners that if you'd like to ask questions, it's very simple. Click on the Q&A bubble at the bottom of your screen, and when we start the question and answer period in a few moments, we'll get to as many as we can. So let's go back. I think most important, we're all interested in what's happening from here on out, less than what happened before this point. We're meant to social distance and sanitize and shelter in place. With the proposed opening of some aspects of our economy, I understand that you probably have a lot of conversation with small business owners and people going back to work, but what about the women that we've talked about, the tremendous burden? How do we begin to think about the decisions we make for our family? Our children, you might want to highlight a little bit about schooling. Most women are burdened with now the added job of homeschooling and playgrounds and the summer coming up. I'm not sure what we're supposed to be doing. Are we all going to be continuing to wear masks?
Yes, we absolutely are going to continue with wearing the masks, with keeping social distancing within the workplaces, in public places that we go. Children will be home getting their schooling done at home. And we're still asking those who are in the high risk categories, are seniors, people with underlying conditions, stay home as much as you can. And we are working with small businesses and the businesses that begin to reopen to make sure that they have the PPE equipment that they need to keep themselves safe. And the Connecticut Business and Industry Association and the state of Connecticut with the CONSTEP program have a joint venture so that businesses with fewer than 50 employees can request from either CONSTEP or from CBIA that PPE equipment, because we want to make sure that businesses have what they need. Earlier this week, the governor and I announced a huge shipment of PPE, including 6 million medical masks, and this shipment of PPE was the biggest in one day that eclipsed the total amount that we had ordered from January right through May 11th. Wow. So I think now we're more comfortable that we have our own state stockpile of what we need to make sure that state agency frontline workers, healthcare workers, hospitals have what they need. And we want to make sure that businesses, small businesses, have what they need.
And I want to remind everyone, I know you're getting a lot of information, but this webinar will go on the Connecticut Women's Hall of Fame website with the links to some of the very important information that the Lieutenant Governor is giving us. So if you have an interest and you need to know about food security, about PPE equipment, about the new guidelines, we will have that by the end of the day online for you to just a click away. So that's very important information.
I noticed that someone asked about libraries, and I am the daughter of a law librarian, and I come from a family of librarians, and I miss the public libraries being open, and municipalities are going to be in charge of coming up with some dates for that, and that's a tough nut, because I know how important public libraries are, particularly for computer resources. People, when I go by my public library in Middletown when it's open, you'll see 30 or 40 people waiting at 9 a.m. when the library opens, because they want to go and use the computers to make job applications. So that's been a tremendous loss, and hopefully those will be open soon, but I don't have an exact date for you. Sorry about that.
No, no worries. I just, again, for our listeners, so most of our parks and recreation and beaches are open. Is that correct?
They are, and they have been open. Now, I will say with a caveat that municipalities will occasionally close parks or beaches if they get too full, or if people are not keeping social distancing. State parks have been closed once parking lots get full. And the state parks are open for individual recreation, people using the walking trails, people hiking, people using bicycles, but they're not open for pickup basketball or other kinds of team sports. We wanted to have those open. We also know that our mayor partners are watching very carefully because they're concerned on a beautiful day like today that there might be too many people at the beach in Fairfield, for example.
That's right. That brings me to another question. Enforcement. If we're meant to be social distancing, we're meant to be wearing masks, we're meant to be using some of our open spaces for health reasons, not to lie and catch the rays. How I see it happening all over the country, people are ignoring those guidelines. How will we in Connecticut gently enforce them?
Yes, so I think it's going to really be a matter of sort of societal pressure, if you will. And what happens is, I know when I go to the grocery store, they'll turn away people that don't have masks. So I think each retail establishment is going to have their own rules, and they've been really great about it, marking 6 feet so people with different carts don't get too close to one another. So I think there's going to be individual businesses sort of managing their own space. I tell people, if they see a particular place where people aren't observing, please call your mayor or your first selectman. I wish we had more state police. We're already operating with fewer than we need. And there have been so many people speeding on our roads that our state police are focusing on speed enforcement, because even though fewer people are on the roads, there is a huge number of people going way over 85 miles an hour. So I think if there's enforcement, it's really going to be at the local level with either local police or local public health departments. But I have to say that there's been a real collaborative approach. Businesses have already been reaching out to their public health departments and getting their take on whatever issues they may be thinking about as they start to creatively think how they can keep their business environment safe.
And that brings us to a question from one of our listeners regarding business. Will the Department of Labor have their phone lines opened up to ask questions to a live person? Small business owners have questions that aren't easily answered online.
Yes, and here's what I would recommend to everyone. Call your legislator, call your state representative, call your state senator, because each of them, and I have, each of us has a liaison at the Department of Labor who can help you with those issues, whether it's an unemployment issue or whether it's an issue about getting your people back to work, or questions about what forms you have to fill out. And I will also say that the Department of Labor has stepped up in a big way and processed almost 500,000 claims. And normally you'd get that number of claims over a 3-year period. So in the meantime, please call your legislator and let them know what you need to ask, and they'll get you what you need right away.
And we spent a few minutes talking about testing, and we have a question from one of our listeners. I've read that the Abbott test has a high false negative rate, leading many professionals and hospitals to cease using it. Is this the test being used at CVS testing sites?
I do not believe so. And I will say that the Abbott test has been, in fact, rejected, or some medical facilities have stopped using it because they found that it was not particularly accurate, which is too bad, because it was one of those great things. It seemed like a great thing when it was announced that you'll get the results right away, but the results haven't been that accurate. So that is not being used in most places.
And while we're on the subject of testing, so much interest from one of our listeners. I just scheduled a test appointment for tomorrow. The online form asks about payment. I understood the test was free. Do I need to give my insurance information?
So we have agreements with almost every major insurance company, and our insurance commissioner made sure that anybody could get tested for free. So I'm scratching my head, and you should take a look at the frequently asked questions on the state of Connecticut website on COVID-19, and you'll see that that test should be free. Don't let them charge you. Otherwise, call our insurance commissioner and we'll take care of it.
Great. And of course, you did speak to this earlier, but perhaps our listener wasn't online about when libraries will reopen. But they're also saying that they read that summer camps are reopening. Is that true?
So I think the plan is to reopen them. And I am not sure what date that is. And I would suggest that people take a look at the Department of Economic Development website. But we know that those summer camps are important because a lot of people rely upon them for childcare and to keep their kids engaged during the summer. And I do know, because I've had discussions with them, that those are going to be open.
As you're in Fairfield County today, and I live here, we talk about tri-state collaboration often. And I presume that you are still engaged in that, particularly when we come to reopening in baby steps. Because we're so close to New York and New Jersey, can you talk to us a little bit about how you see that? Because I think people wonder, should they go back to work in the city? Should we travel? Should we not? Should we still not cross state lines?
Well, so first I'll say that I think one of the governor's best leadership traits is that he's a collaborative person by nature. And what we've found is, by working closely with Andrew Cuomo in New York, Governor Murphy in New Jersey, Gina Raimondo in Rhode Island, Charlie Baker in Massachusetts, all our neighbors, that they've given us some amazing insights and great ideas. And the governor is in frequent conversation with his colleagues and our counterparts. Our DEP commissioner, our parks commissioner, talks regularly with her Rhode Island counterparts and her New York counterparts. So we've learned a lot from each other, particularly from New York and New Jersey, just because they've been hot spots. And we've enjoyed that. We found that it is extremely beneficial. And we think it's important because COVID-19 doesn't just stop at a border. It doesn't understand borders. And I don't think people have to worry that they will be stopped at any borders. We've never done that. I do think people are going to have to decide based on their circumstances, their health, their profession, the needs of their family, how to proceed. It's one of those, we are all figuring this out as we go, and we're just going to have to do our best to be as smart as we can about it.
Well, I should say that my mom lives in Massachusetts, and we recently went up on Mother's Day practicing social distancing to drop off some things. and sit outside. And we passed through Rhode Island, and we did have to stop, but it was very simple, and I felt actually happy to be a part of the kind of care that states are taking about their citizens. And I said simply, we're not staying in Rhode Island. We're on our way to Massachusetts to visit my mom. And it felt like we're all in this together, and it's a community, and no one is pressuring us. We're just trying to do what's best for ourselves and all those around us. Would you agree?
I would, and I know they're doing that in Rhode Island, but they are a state of 2/3 fewer people than we have here. So we are keeping our state police troopers busy making sure that our roads and highways and that our state is safe, but we've not been having those conversations with people at our borders. And I would say we've been welcoming because we've had people from New York go to Litchfield County where they feel they're safer to stay at their summer home or to rent a place. So we've been the welcoming place that we've always been for everyone, from people from other states and people from other countries.
So the woman who asked the question about testing says a follow-up. I went to the state website, found the clinic for tomorrow's free COVID test appointment. The appointment is confirmed, but the next test screen is an online form requesting insurance information. Should I provide it?
Oh, so yeah, so I would say yes, because the insurance company is going to pay for it. I meant you don't pay out of pocket.
Gotcha. Thank you for that clarification. That's important.
Yeah, I appreciate that.
That has answered that question. We're coming to the close of our time, and I just wanted to ask you, particularly as we keep a feminine lens on these issues with the Connecticut Women's Hall of Fame, what would you say to all of the women out there who have a disproportionate burden during this pandemic?
Oh my goodness. The governor and I are so empathetic. Thank you. If you're on the front lines, if you're one of those healthcare workers, if you're one of those grocery store clerks, a delivery person, thank you, thank you, thank you. We are so grateful for what you're doing. We're all in this together. If there's anything anybody needs, they can email me at the Lieutenant Governor's office. The governor and I are ready to help in any way that we can. We have some very hardworking partners at the municipal level, our mayors and first selectmen. They've been great, as have our legislative partners. So call any of us. It's a great honor to represent all of you. And if you need something, you have a good idea, you think we can be doing something better, please let us know.
Once again, thank you to our guest, Lieutenant Governor Susan Bysiewicz, and thank you to all of you out there who are listening. And please join us next week when I speak with Kika Matos, Director of the Center on Immigration and Justice at the Vera Institute. Our subject matter is called Ayuda, Latinos' Unique Challenges in the Pandemic. For more information, visit cwhf.org and look under What We Do for all our webinars past, which are online in video form, and future. Thank you all once again, and I remind you, stay healthy, stay happy.